So there are really two aspects to ovarian reserve. Ovarian reserve is really made up of the quantity of the eggs and then the quality of the eggs. The quantity of eggs is something that's fixed at the beginning of a woman's life. A woman is born with a certain number of eggs, usually measured in the hundreds of thousands, and if they're not in the right hormonal window to be recruited to make an egg that ovulates, then they just will go away. Quality is really more tightly related to patient's age. It's something that we can measure after an embryo is created because we can test that embryo and see if it's genetically normal. However, that's a fairly involved process, it's expensive, it's invasive of the embryo, so that's not something we go to right away, and we just use age as a bit of a surrogate marker. If the patient comes in and she hasn't been able to get pregnant, then we will do an assessment of quantity of eggs. And the quantity of eggs is measured by one of three tests that are conventionally used nowadays. One of them is the FSH level. The FSH level, if it's high, means that the body is struggling to try to make eggs. And in that case, if it's high, then she has low ovarian reserve. AMH is the opposite. If the AMH is high, it reflects a higher number of eggs. And finally, the antral follicle count, which is an ultrasound where we measure the number of little cysts that contain eggs, is a reflection of number also, and the higher it is, the better the ovarian reserve. Some patients come in with commercially available AMH results, for instance, that in some way worry them because they are felt to be low. I would tell that patient, be very careful because it's not as likely to be as predictive as you think. In fact, in the absence of trying to get pregnant on your own, it's probably meaningless. And I would recommend that you see a professional if you have any questions about ovarian reserve testing.